Delta has arrived in Taiwan. Not the airline, the COVID-19 variant that's at least 40% more transmissible than previous variants.
We'll tell you more about Delta, how it has spread in Taiwan, and how it's affected local mango farmers.
Later in the show, we'll compare the side effects of the two vaccines available in Taiwan, AstraZeneca and Moderna.
And in Hashtag Taiwan, Leslie Liao brings you an inside look at what it's like to be a nurse during an outbreak of COVID-19. This is Taiwan Insider. We have good news today. Taiwan's case numbers are dropping. There are only 47 local cases today. And for the past 3 weeks, our R number has been under 1, which means the virus is spreading slower and slower. But there has been some concern over the Delta variant. And this is how it came to Taiwan.
As daily COVID-19 cases begin tapering off, the question on everyone's mind now is, should we be worried about the Delta variant? First discovered in India, this more transmissible COVID-19 variant is causing concern in Taiwan. A woman in her 50s and her grandson brought the strain to Taiwan when they returned from Peru on June 6th. There's now a cluster outbreak of 15 COVID-19 cases in southern Taiwan's Pingtung County. Health authorities have confirmed that 12 of the 15 cases are the Delta variant. One is awaiting genetic sequencing results, while the last 2 cases' strains can't be determined. One of the 12 Delta cases is a fruit farmer. Health authorities have yet to definitively determine how the farmer contracted the strain, though they suspect that it might have happened when he visited a hospital on the same day as another confirmed case. The hospital the fruit farmer visited suspended operations for 2 days to undergo disinfection. 399 people who have come into contact with the fruit farmer have all been sent to quarantine centers. With COVID-19 subsiding across Taiwan, the last thing the country needs is the Delta variant flaring up.
So what is the Delta variant and how big a threat is it? Well, Staś Butler tells us all about it on Taiwan Explained.
In viruses as in life, change is inevitable. Since the COVID-19 pandemic began, scientists have identified hundreds of new variants of the virus, each with slightly different mutations. In Taiwan, all eyes are on the Delta variant after a cluster infection in Pingtung County. But what's special about Delta, and how worried should we be? The World Health Organization, or WHO, groups COVID variants into variants of concern and variants of interest. Delta is a variant of concern. Like all variants, it has a place in the virus's lineage. This graphic is a big family tree showing how all COVID variants are related. And here's a simplified version with all the WHO variants, with Delta on the right-hand side. Delta is closely related to Kappa, a variant of interest also first found in India. According to the European Centre for Disease Prevention and Control, Delta has 4 spike mutations of interest. One mutation is common to all WHO-listed variants. The second is shared with Epsilon and Kappa, the third just with Kappa, and the final mutation is unique to Delta. What does this mean? Well, the WHO and the US Centers for Disease Control and Prevention, or CDC, use similar criteria to say whether a variant is of concern or not. Essentially, those are: could the variant make diagnosis, treatment, or vaccination more difficult? Could it spread more easily? Or could it cause more severe illness? We'll look at these in order. So could Delta make diagnosis, treatment, or vaccination more difficult? Well, the short answer is possibly. The US CDC website points to this research paper. It looks at the Epsilon variant, which has one of the same mutations as Delta. The paper suggests decreased antibody neutralization, or essentially a weaker response to the virus, even among people who are vaccinated. But it still hasn't been peer-reviewed. The good news is that Public Health England in the UK says vaccines are still very effective at preventing hospitalization. The organisation says if you've had 2 jabs, you're unlikely to get sick and you're even more unlikely to need to go to hospital. Okay, moving on to our second cause of concern. Could it spread more easily? The short answer is yes. Research from Public Health England suggests that the Delta variant is about 60% more transmissible than the Alpha variant, which was first detected in the UK. And remember, the Alpha variant itself was already much more transmissible than the original virus, so it's likely Delta could spread quickly in Taiwan if not contained. That brings us on to the final question. Could it cause more severe illness? The short answer is it's not clear yet. Right now, the Delta variant is driving a surge in cases in the UK, but there hasn't been a big rise in deaths. That's probably at least partly because most high-risk groups have already been vaccinated. Some data also suggests that the variant could be less deadly than the Alpha variant. But those numbers could change, so right now it's too early to tell. As for people in Taiwan, regardless of the variant, the guidance stays the same. Keep away from big groups, wear a mask, stay at home, and get a vaccine when you're eligible.
So the Delta variant is easier to pass along and easier to get. So how would you know if you have it? Well, here are some of the symptoms.
A cough, a fever, and a lack of smell or taste. These are all classic COVID-19 symptoms, but a new study out of the UK has found slightly different symptoms for the Delta variant. Researchers at King's College London are collecting data from patients using a mobile app. They found the most common symptom of the Delta variant is a headache, followed by a sore throat, a runny nose, and a fever. Less common symptoms of the Delta variant include a cough, while loss of taste and smell is not even among the top 10 symptoms. National Taiwan University Hospital's Dr. Li Bingying says the findings are still preliminary and awaiting more formal study. If a runny nose becomes a much more common symptom, that could be a good development, he says. That could mean that the virus is overall less aggressive. But Taipei City Hospital's Dr. Su Yifeng says that just because you have a runny nose does not mean you have the Delta variant of COVID-19. There are a lot of reasons why you sneeze, he says. It could be allergies, the common cold, or other respiratory viruses. Experts say the Delta variant is at least 40% more transmissible than the Alpha variant first found in the UK. And the best form of protection? Get vaccinated. For the past couple of months in Taiwan, if you've gotten a COVID-19 jab, you've probably gotten a dose of AstraZeneca. But now there's a new kid on the block, Moderna. So how do the vaccines differ? And what are the side effects? Here's more.
Taiwan's supply of COVID-19 vaccines continues to grow. The latest shipment, containing 410,000 doses of the Moderna vaccine, arrived Wednesday afternoon. Most of those vaccinated in Taiwan in the near future are likely to get the Moderna vaccine because Taiwan has a relatively large supply of doses. But there are still doses of the AstraZeneca vaccine ready for use. And doctors like Liao of Xinhong Wuhou Su Memorial Hospital say that people shouldn't be overly concerned about which vaccine they get. There are, of course, differences. Li Bingying of the Central Epidemic Command Center says the AstraZeneca vaccine can lead to blood clots, while the Moderna can lead to myocarditis. Rates of pain at the injection site, fever, and chills differ between the two vaccines too, as does the overall rate of effectiveness. But the general consensus among doctors here is that serious side effects from these two vaccines are rare, and there is no need to be picky when it comes to which vaccine to get.
Now, I will always jump at an opportunity to do a story about mangoes or to eat mangoes if possible, but it seems like for the past couple of months we've only been talking about the pandemic. Well, believe it or not, we have a story that's related to both.
Mango shaved ice is the perfect treat for a hot summer's day, and mangoes from Fangshan Township are the cream of the crop. But a recent outbreak of the COVID-19 Delta variant in the rural area has given pause to some. One viral message claims that you shouldn't smell fruits when buying them because some fruits can carry the virus. That goes especially for mangoes, the message says. And it seems the words have had an impact on sales. One local farmer says customers have cancelled over 100 boxes worth of orders. But Pingtung County agriculture official Zheng Yongyu says that the mangoes are not a threat to people's health. He says there have been no reports anywhere in the world of fruit carrying COVID-19. Lawmaker Zhou Chunmi says authorities are in contact with local mango farmers. She says they're setting up an online ordering system to address people's concerns, ensure that Fangshan mangoes are safe to buy. Officials hope they can send out the right message to get people buying these sweet fruits again. That way, the ongoing COVID crisis won't leave these mango farmers feeling bitter.
Now, I'm happy to report that since this story broke, those mangoes have all sold out. Now, I tell you, I'm always happy to do my part to help the local farmers, especially if it means eating more mangoes. Up next, Hashtag Taiwan with Leslie Liao.
Being in medicine is not easy. If it were simple, I'd do it, but then again, I'm squeamish, forgetful, and the sight of blood makes me grimace, faint, and scream all at the same time. The thing is, medical professionals deserve our respect even in normal times because our health depends on them. But just in case you forgot, we are not living in normal times. COVID-19 has turned the world upside down and shaken it into oblivion. Frontline medical workers are the ones healing infected people and keeping this outbreak from getting any worse than it already is. Now, I'm not here to make the case that we should appreciate medical staff more, because no matter how much we do thank them, it will never be enough. I'm not saying society is ungrateful, I'm just saying medical professionals have done that much for us. But there's a certain detachment to my understanding of medical work that needs remedying. I know they're exhausted, I know they're slammed. But what is their day like? What are they thinking? How stressed are they? Should we be worried about them succumbing to said stress? These are the questions I ask because I want to know what they go through. On Sunday, I got a glimpse of the answers to my question when New Taipei City Mayor Hou You-yi posted this video to Facebook. It's a 1.5-minute video that depicts what a New Taipei City nurse does in the time of coronavirus. You're gonna want to get the tissues because this one's a real heart-wrencher. The video starts off with the nurse at a quarantine center. She walks into a room where an old woman is staying. Here's the part that kind of surprised me. The nurse holds up a phone so that the quarantine patient can speak with a doctor. I never knew that nurses had to act as bridges between doctors and quarantine patients, and that only made me realize how little I knew about what medical staff were going through right now. Think about this for a second. Really think about it for a second. The nurse exposes herself to a deadly virus every day to make sure that others are okay. It's a mind-blowing level of selflessness and risk, one that makes me worry that medical workers will one day get fed up and quit. But the video catches up with the nurse, who then says she doesn't think she's particularly brave, she's proud to be a nurse, and the only thing she worries about is not doing enough. We then cut back to the quarantine room where the old woman says thank you to the nurse. The video ends with the nurse saying she misses her family and she really wants to go home right now but can't. She says she knows her family is thinking of her and that's all she can really ask for. Now, this wouldn't be Hashtag Taiwan if I didn't end on some kind of a witty quip, but I've got none for you this week. Because no matter what I say, it can't be anything more impactful or profound than that. It's just not gonna happen.
Before we leave you today, let's take a look at some of the other stories on our radar.
Taiwan and the U.S. have resumed trade talks after a 5-year hiatus. During a virtual meeting on Wednesday, the two sides discussed issues like strengthening supply chains, market access for U.S. pork in Taiwan, and the possibility of authorizing Taiwanese companies to make COVID-19 vaccines. Taiwan is hoping the talks will lead to a free trade agreement. A third shipment of Moderna COVID-19 vaccine doses arrived in Taiwan on Wednesday. The addition of 410,000 doses means close to 1 million of the 5 million Moderna vaccines Taiwan has ordered have arrived. Taiwan has received more than 5 million total so far, mostly donations from the US and Japan. A second Taiwan-developed vaccine for COVID-19 has just finished Phase 2 trials. United Biomedical applied on Wednesday for emergency use authorization in Taiwan. It is now set to launch Phase 3 trials in India. Meanwhile, the EUA application for the other local vaccine, developed by Medigen Biotech, is likely to be pushed back to late July because of missing documentation. Apple Daily Taiwan is looking for a new owner. The publication was the biggest circulation newspaper in Taiwan before management axed the print version in May and downsized operations. The search for a buyer follows the closure earlier this month of the paper's Hong Kong edition, following the arrest of senior editors and executives. Apple Daily says, though, that its Taiwan operations have not been affected by the events in Hong Kong. The parent company says it's opening negotiations with a potential buyer.
All right, final question today. Taiwan has some delicious homegrown mangoes. What is your favorite way to eat them? Andrew.
All right, my favorite way to eat mangoes, aside from fresh, is, well, have a look at this. This is a mango pudding that I made, and it's topped with some macerated dragon fruit and a dollop of cream. So that's just one inventive and delicious way that you can have mangoes.
So creative, Andrew. How about you, Stash?
My favorite way to enjoy mangoes is straight from the farm. So my landlord, his family actually owns a farm, a mango farm down in Kaohsiung, and every year he sends us 2 big boxes for us to enjoy. So that's the highlight for me.
Lucky Stash. And Leslie?
Alright guys, bear with me because my favorite way to eat mango is that. Now, you can't really see it, but in that bowl is one mango, about 200 grams of Greek yogurt, and some fruit granola. Now, it might look funky, but I promise you that's a one-way ticket to Flavor Town.
Sounds good. My favorite way to eat them is freshly cut. I love those tangy, juicy, bite-sized pieces of mango. They're so delicious. But I must add, there's no better way to cool off in the summertime in Taiwan than having mango iced desserts, which is ubiquitous in Taiwan. Thanks for tuning in to Taiwan Insider. I'm Natalie Tso.
I'm Andrew Ryan. Take care, everybody.
I'm Staś Butler.
And I'm Leslie Liao, asking you to try my yogurt mango granola bowl.
Be sure to follow us on social media. Leave a comment below. We would love to hear from you. Taiwan, you're doing awesome. See you next week.